I'm Dr. Evelyn Reed, an oncologist with over 15 years on the front lines of cancer treatment. In this video, we're going to have a serious, practical conversation about the common, nonspecific cancer signs that are so crucial for early detection. Many of these are things you might be overlooking right now. Knowing them, understanding them, and acting on them could dramatically increase survival rates. Most importantly, it could save your life. Before we get to the specific symptoms, you need to understand why this is so important. When cancer is diagnosed at an early stage, when it's small and hasn't spread, it's far more likely to be treated successfully. For many common cancers, the 5-year survival rate for early localized disease is over 90%. But for cancers diagnosed late, after they've spread, that number can plummet to 10% or even lower. That is a staggering difference, and it all hinges on one thing: early detection. The challenge, and what we're really focusing on today, is that many early cancer symptoms are frustratingly vague. They can easily be mistaken for dozens of other, harmless conditions. Things like fatigue, weight loss, and pain are incredibly common, which is why so many people and sometimes even doctors can initially dismiss them. So, what's the rule? How do we filter out the noise? There are 2 words I want you to remember throughout this video: persistent and unexplained. A cough that lasts for 3 days after you catch a cold is normal. A cough that lasts for 3 weeks for no clear reason is a signal you must not ignore. Feeling tired after a stressful week is normal. Feeling a profound exhaustion that rest doesn't fix, day after day, is a signal. It's this persistence, typically anything lasting more than 2 or 3 weeks, that should prompt a conversation with your doctor. Now, let's get into the specific signs your body might be sending you. We'll start with the general symptoms that can apply to many different cancers, then move to some more specific examples. Number 1. Unexplained weight loss. This is a big one, and it's often overlooked. We're not talking about losing a few pounds after you start hitting the gym or skip dessert. We're talking about losing 10 pounds or more without trying, especially over just a few months. A 2024 study in the Journal of the American Medical Association confirmed that unintentional weight loss is linked to a significantly higher risk of a cancer diagnosis within the next year, particularly for cancers of the upper GI tract, blood, colon, and lungs. Why does this happen? Cancer cells divide rapidly, and that process burns a lot of energy. This can crank up your body's resting metabolism, causing you to burn more calories. Some tumors also release chemicals called cytokines that can disrupt metabolism, break down muscle and fat, and kill your appetite, leading to a condition known as cachexia or wasting syndrome. Unexplained weight loss is often one of the very first signs of cancers, like pancreatic, stomach, esophageal, and lung cancer. So if the number on the scale is dropping and you don't know why, that's a mandatory trip to the doctor. Number 2. Profound and persistent fatigue. This isn't your everyday tiredness. Cancer-related fatigue is a whole different beast. It's a deep, persistent exhaustion that isn't helped by rest or sleep. Patients often describe it as a paralyzing or overwhelming lack of energy that gets in the way of daily life. You might feel weak, have trouble concentrating, that brain fog feeling, and find that simple tasks like taking a shower feel like climbing a mountain. This can happen because the cancer itself releases inflammatory proteins or causes nutrient deficiencies. For blood cancers like leukemia or lymphoma, cancerous cells can crowd out healthy ones in the bone marrow, leading to anemia, low red blood cell count, which starves your body of the oxygen it needs for energy. Fatigue is the single most common symptom people with blood cancer report before being diagnosed. If you feel bone-crushingly tired day in and day out, and a good night's sleep does absolutely nothing, that is a serious symptom that needs to be checked out. Number 3. Persistent, unexplained pain. Pain is tricky because it has countless causes, but pain that sticks around and isn't from an injury or another known issue needs to be taken seriously. While we often think of pain as a late-stage symptom, it can be an early warning for certain cancers. For example, constant pain in your back or pelvis that isn't from a muscle strain could be a sign of cancers like ovarian or spinal cancer. Bone pain that's deep, aching, and often gets worse at night could signal bone cancer or cancer that is spread to the bones. A headache that lasts for more than 2 weeks and doesn't get better with the usual treatments could in rare cases be caused by a brain tumor. And that nagging discomfort or low-level pain in your abdomen after eating could be a sign of stomach, pancreatic, or esophageal cancers. The key, again, is persistence. An ache that won't go away and doesn't have a clear cause demands medical attention. Number 4. Changes in your skin. Your skin is your body's largest organ, and it can offer big clues about your internal health. You should watch for any new spot on your skin or a change in an existing mole. The ABCDE rule is a great guide for checking moles for melanoma, the most dangerous skin cancer. A for asymmetry. One half of the mole looks different from the other. B for border. The edges are irregular, ragged, or blurry. C for color. The color is uneven with shades of brown, black, pink, red, or even blue. D for diameter. The spot is larger than a pencil eraser, although they can be smaller. E for evolving. The mole is changing in size, shape, or color, or it starts to itch or bleed. Other things to watch for include a sore that just won't heal, a waxy or pearly bump, or a flat, scaly patch. Also, a yellowing of the skin and eyes called jaundice can be a sign of liver or pancreatic cancer. Number 5. Changes in bowel or bladder habits. Lasting changes in your bathroom routine, anything that goes on for more than a few weeks, are a critical warning sign. This includes ongoing diarrhea or constipation, a change in the size or shape of your stool, blood in your stool, a feeling that your bowel doesn't empty completely, pain when you urinate a weak stream or needing to go more often, blood in your urine. These can be signs of colorectal, bladder, or prostate cancer. While things like hemorrhoids or infections can cause these symptoms, you can't diagnose yourself. Any blood in your stool or urine means you need to call your doctor right away. Number 6. A persistent cough or hoarseness. We all get coughs, but a cough that lingers for more than 3 weeks, especially if you smoke or used to smoke, needs to be checked out. A persistent cough can be an early sign of lung cancer. If that cough comes with hoarseness, chest pain, shortness of breath, or if you're coughing up blood or rust-colored phlegm, the need to see a doctor is urgent. Hoarseness by itself that lasts for several weeks can also be a sign of cancer of the larynx or thyroid. Number 7. Difficulty swallowing or persistent indigestion. Occasional heartburn is normal, but indigestion that won't quit, or a feeling of pressure, or pain in your chest after eating could be a sign of stomach or esophageal cancer. An even more concerning symptom is dysphagia, which means difficulty swallowing. It might feel like food is getting stuck in your throat or chest. This can be a sign of throat, esophageal, or stomach cancer and requires an immediate medical evaluation. Number 8. Unusual bleeding or discharge. Any bleeding from a part of your body that shouldn't be bleeding is a major red flag. This includes coughing up blood, blood in the stool or urine, vaginal bleeding after menopause between periods, or unusually heavy periods. This can be a sign of cervical, uterine, or endometrial cancer. There are harmless reasons for many of these, but cancer has to be ruled out by a professional. Number 9. New lumps or swelling. Any new lump or thickening on any part of your body that doesn't go away should be checked by a doctor. This includes lumps in the breast, testicles, neck, armpits, or groin. While many breast lumps are harmless cysts, any new lump has to be evaluated by a professional. Swollen lymph nodes, the small glands in your neck, armpits, and groin often swell up when you have an infection. But if they stay swollen for several weeks with no obvious infection, it could be a sign of lymphoma or leukemia. Number 10. Persistent fever or night sweats. A fever is your body's normal response to an infection, but a fever that sticks around for weeks without a clear cause, or drenching night sweats that soak your sheets, can be an early sign of blood cancers like lymphoma or leukemia. The cancer can interfere with your immune system and your body's ability to control its temperature. Now that we've covered the general signs, let's look closer at 2 of the most common cancers: breast and lung cancer, because their early symptoms are so important to recognize. Breast cancer. The most critical thing to know about early breast cancer is that it often has no symptoms at all in the beginning. This is why screening like mammography is so incredibly vital. Current guidelines recommend that women at average risk begin screening at age 40. Screening can find a cancer long before it's large enough for you to feel. When symptoms do show up, the most common is a new, often painless lump in the breast or underarm. But a lump isn't the only sign. Other changes to watch for include changes in size or shape. One breast might become noticeably larger or hang lower than the other. Skin changes. This is a big one. Look for any dimpling or puckering of the skin, like an orange peel. Redness, a rash on or around the nipple, or thickening skin are also important. It's so important to remember that most breast lumps are not cancer. They're often harmless cysts or other benign growths, but you have no way of knowing the difference. Only a doctor can figure that out, usually with imaging and sometimes a biopsy. Lung cancer? Lung cancer is the leading cause of cancer death, mostly because it's often found late. Part of the reason is that early lung cancer either causes no symptoms or causes symptoms that are easy to blame on something else, like a smoker's cough or a cold. The most common early sign is a new cough that doesn't go away or a change in a chronic cough you've had for a long time. It might become deeper, more frequent, or just sound different. Other key signs include coughing up blood. Even a tiny amount of blood or rust-colored phlegm is a major warning sign. Chest pain. This pain is often a dull, persistent ache that can get worse when you breathe. deeply, cough or laugh, shortness of breath, feeling winded or wheezing during normal activities, recurring chest infections, getting pneumonia or bronchitis over and over again, hoarseness, as we mentioned, a raspy voice that doesn't clear up. Unexplained weight loss and fatigue are also very common with lung cancer. For people at high risk, like long-term smokers, low-dose CT scans for screening are recommended and have been shown to save lives. Hearing all this can be overwhelming and it might even make you anxious. That's a normal reaction. But the point of this video isn't to scare you, it's to empower you. Knowledge is your most powerful tool. So, what's your action plan? Step 1. Become an expert on your own body. Nobody knows your body better than you do. Pay attention to it. Get in the habit of knowing what's normal for you, your energy, your digestion, your skin. This isn't about being a hypochondriac, it's about being your own best advocate. When you notice a change, don't just brush it off, acknowledge it. Maybe keep a quick note on your phone, what the symptom is, when it started, and if it's changing. That information is priceless for your doctor. Step 2. Know when to make the call. Remember the rule: persistent and unexplained. If you have a new or weird symptom that lasts for more than 2 or 3 weeks, it's time to call your doctor. Don't wait for it to get worse. Don't think you're bothering them or that it's probably nothing. It is always better to be safe and get it checked out. Step 3. How to talk to your doctor. When you go to your appointment, be direct. That symptom note you made will be a huge help. Instead of saying, "I just feel off," you can say, "For the last 4 weeks, I've had this dull ache in my lower abdomen. And I've also noticed I'm getting full much faster." Be specific, be firm. If you feel like your concerns are being dismissed, it is okay to stand up for yourself. You can say, "I understand it could be a lot of things, but this isn't normal for me, and I'm concerned. What are the next steps we can take to investigate this?" You have a right to be taken seriously. Step 4. Embrace screening. Finally, don't underestimate the power of screening. Tests like mammograms, pap tests, and colonoscopies are designed to find cancer before you have any symptoms at all. Talk to your doctor about which screenings are right for you based on your age, family history, and other risks. For example, colorectal cancer screening is now recommended for average-risk folks starting at age 45. These tests save lives. Period. The thought of a health problem is daunting, but ignoring it is never the solution. Your body communicates with you in subtle ways. Your job is to listen. The message today is simple. Persistent, unexplained changes in your body need to be checked out by a medical professional. This isn't about panicking every time you have an ache. It's about developing a new awareness and respect for your body's signals. Early detection is the single most powerful weapon we have against cancer. It means less aggressive treatments, a better quality of life, and dramatically higher chances of a long, healthy life. You are your own best health advocate. If any of the symptoms we talked about today sound familiar, and if they've been sticking around without a good explanation, please, don't wait. Make an appointment to see your doctor. It is the single most important and empowering step you can take. If you found this information valuable and think it could help someone you know, please share this video.